Hello, this is Michaela Green from Anatomy and Physiology, Section 53, and today we'll be going over cranial nerves. A quick overview of the nerves and some helpful acrostic devices for memorization purposes. 1. Olfactory, 2. Optic, 3. Ocular motor, 4. Trochlear, 5. Trigeminal, 6. Abducens, 7. Facial, 8. Vestibulo-ocular, 9. Glossopharyngeal, 10. Vagus, 11. Accessory, and 12. Hypoglossal. On occasion, our trusty truck acts funny. Very good vehicle anyhow. So that's how we memorize the order of the actual nerves themselves. And on the right in green, the second part here is about whether the nerve is sensory, motor, or both. Some say marry money, but my brother says big brains matter more.
To test these cranial nerves, we have Lee, who has offered to demonstrate. Thank you for volunteering. And the first nerve that we'll be going over is olfactory nerve number 1. That is a purely sensory nerve with afferent impulses for the sense of smell, afferent being going towards our receptor, so towards the brain in a sense. To test the olfactory nerve, we're going to have Lee block his nostril with one of his nostrils. I'm going to place something under it, see if he can identify it, have him do the same with the other one. And it's important when you're doing this to pick a scent that isn't going to make the patient gag. We don't want to test the pharyngeal nerve, which makes someone gag. So we don't want to have that happen. So pick something that's fairly pleasant, fragrant. Can you identify this for me?
That is vanilla.
Okay, good. And just make sure the other one's working.
Yep, that's vanilla.
All right, and that's olfactory nerve number 1.
For the olfactory nerve, fibers arrive from olfactory epithelium and run through cribriform foramina of ethmoid bone to synapse and olfactory bulb.
Next is optic nerve number 2. This is another purely sensory nerve. It's going to be for afferent impulses of vision. And we're going to first test this by having about arm's length apart. And then we're going to mirror each other, covering one eye. Please look at my uncovered eye and don't look at my fingers directly, but we're going to test for peripherals here. And so tell me, how many fingers am I holding up?
3.
Okay.
2.
All right, let's switch eyes.
3. 2.
Okay. Good. And next we're going to do kind of like a standard optometrist test. I'll put something up on the screen here. Lee, can you read the smallest line that you can read from here?
Sure. D, E, F, P, O, T, E, C.
Thank you. And if your patient wears glasses, make sure that they are using them. Also, if this were a real optometrist's office, we could check for the optic discs with an ophthalmoscope to see if there's any swelling there, using those tools.
For the optic nerve, fibers arrive from retina of the eye and pass through optic canal of the sphenoid bone. Fibers partially cross over at the optic chiasma and continue into the thalamus as the optic tracts. Final fibers of this pathway travel from the thalamus to the primary visual cortex as the optic radiation.
Next, we'll be going over nerves 3, 4, and 6 altogether. They're all motor nerves that have to do with the eye. We'll get to the trigeminal nerve 5 later. Ocular nerve 3 will prevent eyelid drooping. It will also control lens movement and pupil size. The trochlear nerve 4 it moves your eyeball left to right, up and down. And then the abducens nerve 6 abducts the eyeball away from the midline of your body, all helping with eye movements, with muscles within the eye. So to test this, we're going to use this flashlight and about 12 to 14 inches away from the patient's nose. And we're going to see if his eye can follow without moving your head in all directions. Nose. Next, we're testing for iris constriction. Make sure that the pupils dilate in the presence of light. Yep, let's test the other eye. There we go.
For the oculomotor nerve, fibers emerge from ventral midbrain and course ventrally to enter the orbit. They exit from the skull via superior orbital fissure. Let's do the trochlear and abducens nerves together. So for trochlear nerve 4, fibers emerge from the midbrain and exit the skull via the superior orbital fissure. And for abducens nerve 6, fibers leave inferior pons and exit from the skull via superior orbital fissure.
Getting back to trigeminal nerve number 5, this is a sensory and a motor nerve. It's going to sense touch in the face and also towards the scalp. It's also a motor nerve for your masseter, for jaw movement. So to test this, can you feel my touch? Clench
Yes.
your teeth? Yeah. And you can still feel my touch?
Yes.
Okay, and also lower your jaw against the pressure of my hand. Good.
For the trigeminal nerve 5, fibers run from face to pons and form 3 divisions. The mandibular division has fibers pass through the foramen ovale in the sphenoid bone, and the maxillary division, fibers pass via the foramen rotundum in the sphenoid bone, and the ophthalmic division, fibers pass through superior orbital fissure of the sphenoid bone.
So remember that we did 6 with 3 and 4, so we're skipping over to facial nerve number 7. This is both sensory and motor in function, and so to test this, we're going to see, can you feel my touch?
Yes.
All right, and can you smile, frown, and puff out your cheeks?
Facial nerve 7 fibers leave the pons and travel through temporal bone via the internal acoustic meatus, exiting via the stylomastoid foramen to reach the face.
Next is the vestibulo-ocular nerve, number 8. This is a purely sensory for the sense of hearing. So I'm going to have you cover one ear. And to one side, I'm going to whisper something and tell me what you hear, if anything.
Kittens.
Okay, good. And can you block the other one?
Puppies.
The vestibulocochlear nerve 8 fibers run from inner ear equilibrium and hearing apparatus housed in the temporal bone through the internal acoustic meatus to enter the pons.
Next is the glossopharyngeal nerve 9. It is sensory and motor. It's going to be sensory for the back 1/3 of the tongue for taste, and then it also has control of movement of the uvula, tonsils, back of your throat. It's also your gag reflexes. So to test this, please use a tongue depressor. Say ah, please. Make sure there's uvula movement. Thank you.
The glossopharyngeal nerve 9 fibers emerge from the medulla oblongata and leave the skull via the jugular foramen to run to the throat.
Moving to vagus nerve number 10, this is also sensory and motor. It is going to be sensory for feeling in your throat, if you have any hoarseness in there, or any sensation when you're eating or you feel hot soup, whatnot. It's also motor for the motion of swallowing. So to test this, can you please count to 5?
1, 2, 3, 4, 5.
Any hoarseness?
No.
And please swallow, which he's able to do successfully.
The vagus nerve 10, their fibers emerge from the medulla oblongata and pass through the jugular foramen and descend through the neck and into the thorax and abdomen.
Next is the accessory nerve 11, which is primarily motor. It provides somatic motor fibers to the sternocleidomastoid and trapezius muscles. So to test this, can you please move your head side to side? And can you shrug your shoulders up against the pressure of my hands? Thank you.
Accessory nerve 11 fibers arise from the superior aspect of the spinal cord, enter at the skull, and then travel through the jugular foramen to reach the muscles of the neck and back.
Lastly is the hypoglossal nerve number 12. This is primarily motor and allows the front of the tongue to move. So, Lee, could you protrude and retract your tongue, please? And move it from side to side. Good.
Hypoglossal nerve 12 fibers arrive from the medulla oblongata and exit from the skull via the hypoglossal canal to travel through the tongue.
Thank you, Lee, for demonstrating the cranial nerves, and thank you, Dr. Wong, for watching.